Well, welcome back, everyone. We hope you enjoyed your first workshop and our chocolate-based conversation if you've been with us over the last 5 minutes or so. We're now turning to a more crucial question, though, than chocolates, which is how can we move beyond good intentions and making volunteering in our sector genuinely inclusive? Because when inclusion shapes who gets to take part, it also shapes whose stories are told and which communities benefit. And I'm very pleased to introduce Professor Martin Webber and Dr. Beth Casey from the University of York. And they'll be sharing learning from 6 museums and nature organisations who have been piloting more inclusive approaches to volunteering. Drawing on their research findings, a community of practice and practical tools, they're going to explore how inclusive volunteering can transform experiences for individuals and strengthen organisations at the same time. Following the presentation, there'll be a Q&A chaired by Rhiannon. Questions can be submitted at any time during the talk, and we'll be using the built-in Zoom Q&A function, which you can find at the bottom of your screen, where there's a little tab, probably on the far right-hand side, there'll be a circle with 3 dots in it. If you click on that, at the top, there'll be something that says Q&A. You can open that. You could submit your questions in there. You can upvote any questions that have already been submitted. And Rhiannon's going to take those and then present them to Beth and Martin towards the end of the presentation. So I'm going to stop talking and I'm going to introduce Beth and Martin. Over to you.
Thanks very much, Matt. And thank you very much for the invitation to present our work to you. We're going to be talking about some research. And of course, we're coming to you from York, from the Chocolate City, just to preface our conversation, to link in with our chocolate conversation. But yes, I'm afraid this isn't going to be necessarily as sweet as a chocolate conversation, or as delightful as thinking about chocolate might be. But hopefully it's going to be important nonetheless, because it's around making the case for inclusive volunteering. We think that evidence is important around that. And we're going to present some work that we've done, some work that we're doing at the moment, and it's really an ongoing journey towards developing that evidence base. And we think that the evidence helps to make impact, and that's why we're in this game. Our work has been funded by the National Institute for Health and Care Research, so we are particularly interested in health and social care outcomes of inclusive volunteering. But of course, that comes with a disclaimer that the words are my own and not of those who are funding us. And the work that we're going to be talking about was within the Ripon Museums, 3 museums in North Yorkshire, very worthwhile a visit if you haven't been already. And it was the supported volunteering program that they set up was funded by the Leo Lyon Foundation. And first of all, just to say a huge thank you to all of those who have been involved in this process, volunteers and staff, other participants in the research, our collaborators from the London School of Economics and University of Oxford, as I mentioned, Leo Lyon and the National Institute for Health and Care Research. I'm going to start the presentation, and Beth and I are going to play tag team, handing over to each other throughout. So there'll be 2 voices coming at you over the next half an hour or so. So firstly, by way of background, information that you already know. You've got expertise in this field. You know that volunteers make a real difference to their communities, to wider society, and to the organisations that they're working within. You're also aware that people volunteer for a range of different reasons, personal to themselves or to the cause or the commitment that they are making to the work that they're undertaking, either to gain new skills, for example, or a meaningful role in their life. It's important, volunteering is important for mental well-being and for making social connections and many other things. There are many outcomes that come from volunteering. But of course, not everyone is able to volunteer because of constraints on their kind of abilities or whatever is happening for them. It could be mental health, it could be physical issues, disabilities, it could be old age, it could be neurodiversity. There might be barriers to volunteering. Some of those barriers are internal to the individual. Some of the barriers are external in terms of organizational barriers or societal barriers. And inclusive volunteering is all about trying to break down some of those barriers for individuals, for organizations and wider society. So it's addressing issues around confidence, stigma, people who may feel that they don't have the experience, or that they feel they may not have anything to offer into a workplace. And inclusive volunteering is all about trying to bring in a wider range of people into museums in particular, as we're talking about today, but across the voluntary sector, to widen up those experiences and provide extra support. It's much more common in health and care settings, and it's definitely considered to be important, but it lacks an evidence base, and that's really what we've been trying to do. So the initial study aimed to explore how and why inclusive volunteering works and to develop a guide to share good practice. We aimed to explore outcomes for people and also to assess costs and potential economic consequences of inclusive volunteering. We're presenting this because this is carrying on in our current work. So we're generating additional data to explore outcomes and also costs in the current work. Previous study, I'm going to hand over to Beth in a second to talk more about this as she undertook the field work. Interviews with volunteers and staff at the Ripon Museums. 3 volunteers completed a reflective diary about their experiences. It's a really useful method because it's completely unmediated by researchers. Volunteers could say exactly what they wanted about their experiences. Beth spent 15 days observing volunteers and support that was provided within the organisation. And we obtained data from 8 volunteers over a 6-month follow-up period. Just indicative, really, in terms of what outcomes might occur, which we are expanding in the current study. Okay, Beth, over to you.
Thank you. Yeah, and it was just to say that the data collection was so enjoyable. It was just such a welcoming place to do data collection. So that was fab. We also had a really excellent advisory group, and that had members which were volunteers from the museum, and also professionals and practitioners working in the sector as well. And we met regularly over the course of the study, so advising on a wide variety of different issues. So it might have been which questions to ask in the interviews to make those kind of as sensitive and as inclusive as possible, through to commenting on the final guide as well. So it was a real invaluable group. And you probably can't read this, but this is just a snapshot from one of the activities that we did during the advisory group. So we were exploring kind of what a theory of change of inclusive volunteering would look like. So that's kind of thinking about the different elements of supported volunteering, what's important in terms of providing support, and some of the changes and outcomes both for the volunteer and the organisation. And we also explored some of the barriers and enabling factors as well for that to work. Thanks, Martin. So after we had analysed kind of all the data from the interviews and the observations, as well as the insights from the advisory group, we came up with this theory of change for inclusive volunteering, which kind of completely underpins the guide as well that we produced. I won't talk through all of this, but just some of the key elements of inclusive volunteering include this providing a really kind of inclusive organisational structure and procedures. So having that really central to the organisational culture and values was really important. Having kind of a clear framework in place. And you can, the next slide shows the interactive guide, but you can, in the guide, yeah, thank you, Martin. You can click on the individual bullet points and that takes you to the relevant section of the guide. If you could just go back a second, Martin, just to that previous slide, that's fab. And then the other important element was providing this person-centred approach, so having very kind of empathic, approachable staff, providing a real kind of trusting working relationship as well. And these were just some of the really important individual outcomes, including kind of building positive relationships, increased social connections with volunteers and also within the community, an increased sense of self-growth, so including kind of increased confidence and self-esteem, and also the importance of providing a sense of purpose and identity, and also some really important outcomes for the organisation, so including kind of raising the profile, increasing diversity, and really, you know, the volunteers were bringing a real wide range of skills and knowledge to the role and to the museum as well. Thanks, Martin. And this is just a link. You can just explore it in your own time if you want to. You can just click on the guide or the QR code here. We had a photographer take some really nice photographs as well of the museum. So yeah, you can explore that in your own time. And this was just a case study as well from one of the volunteers. So this person had been experiencing mental health issues and also periods of social isolation as well. They were potentially worried about stigma from organisations, and they had quite past negative experiences of volunteering due to the impact of COVID at a previous place, just wanted to say. Their goal as well, they really wanted to work with people, and they also had an interest in history and really wanted kind of a varied role, but obviously they had some apprehension due to their past experiences. In terms of the support and training, they found it kind of really friendly and inclusive and a real understanding approach. And they really valued the approach of having a duty manager. So someone was on hand if there were any issues, but it wasn't, you know, completely obvious that the support was being provided, but they could come down if there was any issues at all. They really felt listened to as well. They felt volunteers were taken seriously. They felt that the communication as well was really honest and open, and they really benefited from ongoing learning from others as well. They'd also started to attend socials and staff meetings, and they really felt kind of part of a team and part of the museum through these attending meetings and also receiving updates and being on mailing lists as well. And they really just felt happy at the museum. They enjoyed the role and really looked forward to it. So some of the outcomes for this volunteer, they'd increased knowledge about history, and they were continued learning in their spare time as well. They were meeting new people, starting to feel less isolated, and felt they were improving social skills as well, and just a general feeling of being more connected. And for them, they felt that the role provided kind of a sense of structure. It was a good balance of not providing too rigid a structure as well. And they thought they had kind of a change in attitude because they were starting to join in and attend and enjoying social events as well and feeling comfortable taking part. And they felt kind of a real sense of purpose and achievement from their role. And I'll just talk through this quickly. Another case study. So this volunteer had recently been made redundant, and they were experiencing really low confidence due to that. And they'd also experienced the impact of COVID lockdowns, which had impacted quite negatively on their well-being. They were also experiencing some physical health issues, but they'd completed some recent training in IT. And their goals, they kind of wanted to gain experience and increase confidence as well, with the aim of returning to paid work. In terms of the support and training, they found that the staff were really easy to talk to. The importance of them being open to new ideas as well, and to listen, like properly listening. Support was more intense to start off with, but then as this person grew in confidence, it became less direct. They thought it was an importance that they were given a choice over the role as well. And they felt again that volunteering wasn't as stressful as paid work. They felt they could go at their own pace. There was less pressure as well. The outcomes for this person, a sense of purpose, feeling valuable, and that they were contributing as well. and an increased sense of confidence when socialising with others. This person had also started to get involved in events like wellbeing walks, but obviously, you know, still a challenge, and it was had like a long-term goal really of paid works, but they were certainly on the way towards that. And again, they'd felt as if they'd gained and improved skills, particularly in IT.
So in some of the data that we collected, we had 6-month follow-up data, but it's too small for quantitative analysis, little change in outcomes. And this really represented one of the challenges in terms of evidencing inclusive volunteering. Samples are often small and change is difficult to observe. But it's something for us to think about in terms of how, as a community, we can gather larger scale data to illustrate the changes, the very real changes that are happening for people. One participant did gain part-time employment during this evaluation, and that in particular had an impact on the costs. So we did an indicative cost evaluation to scope out how much the organisation is spending on inclusive volunteering, but also what the potential gains are for individuals and for wider society. So these are very much indicative, representative costs, and I'll talk you through them a little bit. In the next project, we're hoping to scale this up to get better data. But first of all, the person moved into part-time employment, so there's a productivity gain of about £20,000. We collected service use data from these 8 participants, and that over the 6-month period reduced by a cost of £5,800. And for the organisation to support 12 new volunteers, there's an annual cost of staff time and associated resources of just over £50,000. So based on the contribution that volunteers are bringing back into the organisation, volunteering for an average of 4.5 hours a week, of course, all of this is averaged out, it's indicative, is about £30,000. So I'm not a health economist, but looking at how these numbers kind of add up, in terms of the investment that is put in, it's kind of balanced out by the outcome that the organisation gets of £30,000, wider society gets in terms of that £20,000, and services are going down. So it's saving kind of money in terms of external services. So we're developing this further, as we're going to explain in the next study, to help out other agencies, organizations investing in volunteering. So we're now kind of scaling up that initial study, as Matt said in the introduction, with 6 organizations, either in the heritage sector or nature-based organizations, really aiming to look at how inclusive volunteering can be enhanced within these organizations, looking at individual outcomes and also looking at outcomes for the organizations. We've established a community of practice of these organizations to support their development. This is providing consultancy and support, and we're also collecting data. We're researchers after all, we're interested in data, and we need that to observe what's happening, how it's happening, and what outcomes are occurring as a result of that. We're using structured measures again to evaluate outcomes, and again, we've got a cost consequences analysis. The program theory, which is in the guide, we are refining and developing that and really deepening it and extending it through the research. So 6 organizations, many of whom are represented in this virtual space today. So thank you very much for being part of this project. We're very grateful for your involvement. Looking forward to seeing you again tomorrow for our next community of practice meeting. And what we are doing is meeting over a 6-month period intensively, at least once a month anyway, every 3 months thereafter, to really enable the organizations to share good practice, but also to troubleshoot. And it's a safe space in which they can ask questions and try things out. We're very, very pleased to also have the Ripon Museum Trust involved, acting as independent consultants who are outside of the process, but reflecting back on their experiences of doing the same and providing that independent consultancy. Back to you, Beth.
Thanks, Martin. Yeah, so in terms of the individual site plans, we found that all of the organisations were already doing some amazing work in terms of being really inclusive. So what we asked them to do is to come up with kind of an individual plan, just to see how they can develop their existing support, maybe just to add something a bit different to what they're already doing. So a real variety of plans here. So the Imperial War Museum, they're hoping to make it as accessible and inclusive as possible for new and existing volunteers. So focusing on kind of an inclusive culture and support systems. We've got the John Hall Wellness Garden as well, which is run by Rethink Mental Health. They're going to do, they've got two aims. So one of it is to make employment opportunities for volunteers, and also to develop the involvement in volunteers more in kind of service planning and decision making as well. We're really happy we've got London Zoo on board, and we're going to be we're looking forward to receiving your plans soon as well. We've got Beamish Museum, so they're going to be revising and standardising the existing process of inclusive volunteering and setting up a role profile as well. And that's around existing volunteers supporting people with additional needs. We've got Sedgwick Museum in Cambridge. They're setting up a new initiative which is aimed at reducing barriers to volunteering, with a particular focus on engaging neurodiverse young people as well. And we've got Forestry England, who are going to be working with existing volunteers to create a new role as well. I can't see the bottom of that. Oh, 2 seconds.
The Feel Good in the Forest volunteer buddy.
Thank you. So in terms of the data collection timeline, between November 2025 and May 2026, and September 2026 and February 2027, so kind of two separate data collection time periods, we're going to be carrying out observations. So really kind of mirroring the data collection methods that we had in the Ripon study. So we're going to be carrying out 4 site visits to understand how the support works in practice. We're going to be carrying out semi-structured interviews, although we've called them conversations because we found that some people are really kind of can be put off by the term interviews, especially if they've experienced negative experiences before. So we're carrying out conversations with staff, volunteers, referrers as well, who refer into the organisation. So they might be social prescribers, for example, the job centre as well, just a wide variety of different referrers. We're also going to be speaking to family members and carers, because sometimes they have a really important role, particularly when people first start volunteering as well, and other stakeholders as well. So that'll be amounting to 40 people. And we're hoping the information will help us gain a better picture really about how inclusive volunteering works and how it works in terms of the different plans as well, and the wide variety of settings that we've got. From November 2025 to February 2028, we'll be conducting the pre-post outcome interviews with about 80 new volunteers, and that's across the 6 sites who have joined the new inclusive volunteering programmes. And then we're going to be following them up at 3, 6 and 12 months. We haven't decided yet, we haven't finalised the measures that we're going to be including in those questionnaires, but they will be covering things like well-being and social connections, as well as service use as well. We're also going to be carrying out an economic evaluation, which Martin's already talked about in the previous study. Sorry, my the bar at the bottom keeps coming up, so I can't see. And then in terms of the outputs now, we're going to be putting together a research report with a full program theory, which is going to be summarising the key findings, the benefits and outcomes, both for individuals and the organisation. So we'll be combining all the data from all the partner sites to produce that. And then we'll be revising the Inclusive Volunteering Guide, again, incorporating the data and findings from all partner sites, as well as input from the advisory groups as well. So we've got 2 advisory groups, a volunteer advisory group and a professional advisory group as well. We'll be producing a tool to help organisations calculate the costs and benefits of developing an inclusive volunteering programme. And then other outputs will include kind of conference papers, reports, and academic papers as well. I think that's the end now. So thank you. Thank you very much for listening. And if you wanted any further information and also to join our mailing list as well, we've got the QR code there. Hopefully that'll take you to the link.
Wonderful. Thank you so much, Beth and Martin. Some brilliant comments in the chat, so we'll make sure that that's saved for you and you can have a little read through it. And we've got lots of questions. Should we stop sharing in a moment, give people a chance, and then we will go through as many questions as possible. We're in the slight graveyard shift just before the break, so we'll get as many done as we can, and then if there are any outstanding, I'm sure that Beth and Martin will be happy to answer them afterward, and we can put those in your packs. So everyone's been getting on really well with the Q&A function in Zoom. I only learnt to use it last night, so well done everyone, firstly. And lots of upvoted questions. So the first question comes from Joanna. Thank you, Joanna. Did you just look at impact on individuals, i.e. volunteers and organisations, or did you also look at the impact of inclusive volunteering on communities?
It's such a good question because we know from our experience how volunteering has an impact on communities, but gathering data on that is really difficult. In particular, we had data from 8 people. So exploring the impact of that volunteering of those 8 people on communities is very difficult indeed to try to scale that up. However, with the cost benefit data, we are able to make some models, make some assumptions, aggregate data in terms of its wider societal and communal impact to make some conclusions about that. So going forward, kind of half yes would be the answer, I think.
Lovely. Anything to add, Beth?
Yeah, it's a really good comment, actually. And we did wonder in the last study, there was a lot of involvement of the wider community as well, through different social events, kind of partnership with other organisations, particularly involving referrers as well. So it is important, I think, to kind of understand the impact at that wider level. Maybe some of the interview questions might include that as well. Thank you.
Fabulous. So the next question is from Adam. Did you look at intersectionality within the study? So what other individual and societal characteristics played out?
Beth, just so I don't hog this, do you want to start off with this question? We can alternate if you like.
Yeah, that's fine. In the questionnaires, we did ask some demographic information at the start. So that was quite important at that level as well, to kind of understand kind of individual demographic factors, as well as things like we looked at whether people were employed in different roles, the type of support people were receiving as well. It is something that the advisory group had brought up as well, in terms of whether to include things like asking people directly whether they had a disability, things like that. So they're definitely things that we're going to have to think about, I think, particularly in terms of the questionnaire. And And I think for the interviews as well, we'll be speaking to volunteers with additional needs across like a wide, diverse population. So I think it is definitely something. Some of the themes that'll emerge will definitely cover that, I think.
Definitely. Just to add that in practice, also bringing in supporting people in a different context who wouldn't ordinarily be there. That raises issues within kind of the culture of the organization, and it challenges people. And so I think intersectionality, where it actually kind of works out in reality, is an issue for organizations to embrace, but also to understand the potential and real challenges and work through those with people. And I think a lot of it is about cutting through stigma and prejudice around difference, diversity as well.
Lovely. And a sort of quick question on that. We've got one participant who's asking how you feel about asking people to declare their disability or special needs when applying to volunteer, and if you have any thoughts on that.
Yeah, I think that the way around is about making this entirely inclusive, that these questions are asked to everybody, so that it just becomes part of routine information gathering at that assessment point, and it's not just about focused on people because you think that they might have additional support needs, but making it so that it's routine for everybody.
Definitely as well. And I think just because somebody, has a particular need, it doesn't mean that the support is the same for every individual. So it's probably just asking. I had this conversation actually with one of the sites, and just asking kind of quite simple questions about what is it we can do to help you to volunteer successfully. So sometimes you don't even need to kind of ask it directly. So that would cover it. Yeah.
Yeah, and I think I found actually providing regular opportunities for people to refresh how they answer these kinds of questions. I think people are potentially initially reluctant due to trust of an organisation, but actually as they get to know you, get to see what you're about, people are more and more willing to talk about what's going on for them. So I think also providing, multiple ways and opportunities to do that. Another question. So if you're a small charity with limited resource, could you identify the interventions with lowest cost, in inverted commas, and highest gain for participants and the charity? Big one.
That's such a good question. I think partly it's around finding finding capacity is such a difficult thing in small organizations where you've got a couple of people and they're already completely run off their feet, really busy, and managing volunteers, you need the volunteers in there to do the work. So providing extra time for some people can be a real difficult drain on resources for the organization. So it's about a long-term investment. I think that's certainly what we've learned through this process with Ripon Museums. So what we found there is that the putting that time in over a long period of time means that you've got volunteers who are happy, content, giving more and more time, so giving more back to the organisation. And there's an experience that they have become leaders in their own right, so they're now training others and so on. So it's difficult to identify kind of like a quick win in terms of an investment in one area, then you're going to get a bigger outcome. It's very much around a slower process of investing over a longer period of time. And then you can see the benefit kind of that accrues as a result of that. I'm probably sidestepping the question a little bit. I don't know, Beth, if you've got any insights into that.
Yeah, I mean, it is always a barrier, isn't it, in terms of funding and cost and getting staff in who can support people. I think one of the things that came out of the Ripon Museum was just in general having kind of a real welcoming, inclusive culture. So when I observed volunteering in the garden that they had there, that was a really nice setup. That was kind of a free approach, if you like. They had a structure where they all just enjoyed a tea break and a cup of tea. And it was kind of like just really inclusive. to everybody, really. So it is about breaking down those barriers and stigma as well.
Perfect. I'm going to sneak in 2 last questions, even though break time is pending. But maybe if we could go for swift answers if we can. Not that easy. One of the questions was, the volunteers involved in the project and case studies, did their inclusive volunteering continue post-project? And what sustainability measures were put in place? And I think that's a really lovely question, because it is the legacy of their involvement.
Just referencing my previous answer, really, I mean, it's mixed. Yes, you do have some who have continued, and I was thinking in particular of some who have stayed and are now leading and training others. So are providing a lot more back into the organisation. Others went on to other opportunities in terms of volunteering and employment. So it's very much mixed. Sustainability measures, I think it's that long enduring support, so that they feel supported by the organisation as a whole.
And I'm going to end on a slightly provocative question from Chris, because I love a provocative question. Are we still guilty of trying to help people adapt to our volunteering rather than adapting our roles, systems and activities to be more accessible and inclusive? What are your thoughts?
Yes.
I thought that might be it. Do you want to expand a bit, Martin? Or
one of the key elements of the guide and of the research is around the organisation changing, and it's not about changing people to fit. It's about changing the organisation to be inclusive and open, so that anybody can come along and be a volunteer.
Wonderful. Anything to add, Beth?
No, just to agree, really. We had our first advisory group with the volunteers, and somebody was talking about they wanted to be involved in a kind of wider variety of roles, because of their needs. There was only, a couple of roles available. So it's definitely a factor, I think, that you need to have that combined approach, really, with the support and also making the roles accessible.
Wonderful, thank you. Well, that's a really good place to sort of pause that conversation. I'm sure we will keep having it. A huge thank you to Martin and Beth for your presentation and openness within those questions. And I'm going to hand back to our chair, Matt.